I'm Ben Goldman. I supervise the Office of Addiction Services and the Tobacco Program in the Center for Health Equity under Louisville Metro Public Health and Wellness. The main thing that entails is supporting my team as we implement the city's substance use disorder plan. It's a plan currently of 10 goals focused on prevention, harm reduction, access to treatment and services, and recovery support. So we have a lot of different programs and partnerships in the community, and we're trying to address as many of the components of the substance use epidemic locally that we can.
My name is Jennifer Twyman. I am technically a health education specialist too. I work full-time in the syringe exchange. The syringe exchange is often the only place that our people can have a conversation about their use safely without being judged. And that's the best way to keep people safe, is for them to be comfortable to come and talk to you about medically or physically what's going on with them. Hep C and HIV can be spread through blood, so sharing syringes is never, ever a good idea. One of the things that we preach is safe injection. Once the exchange is open, we're really busy these days, so it's a constant, usually steady stream of people. They bring syringes that they've already used back, and I give them new ones. The evidence shows that it works.
Part of my work in the Center for Health Equity is leading the Social Connection Root Cause team. And when we talk about social connection, the interest in social connection and the conversation around it has really increased in the past few years as a result of what researchers call the deaths of despair. That's primarily drug overdose and suicide, but also some researchers talk about homicides as being in the deaths of despair category as well. And really, one of the things that these deaths often have in common is a threat of social isolation. So we know that sort of as a culture, there are factors at play, both economic and sort of cultural, that are leading to increases in social isolation. And we also know that social isolation has a ton of negative health consequences. Social connection is very protective. Humans are social animals, and social interaction is as important to our well-being as other necessary components of life, like shelter and food. So social isolation has the possibility of having as strong a negative health consequence as not having access to healthy food or not having adequate access to stable housing. Some research estimates the impact on mortality of being socially isolated as comparable to smoking about 15 cigarettes a day. So it really is something that is a root cause of health, a social determinant of health. So we've started talking a lot more about it because it's related to all of these health outcomes, not just the deaths of despair, but also chronic disease like diabetes and heart disease, as well as, not surprisingly, mental health issues, depression and anxiety. So we're really interested in identifying ways that social connection can protect people, and also to find the areas where social connection is most essential. And one of the areas that we know social connection is really important is around substance use overdoses. A piece of that is sort of the general well-being component, that someone who's socially connected is likely to have better health and better mental health and have more resources available to cope with a substance use disorder. But also there's a really practical component. When somebody's suffering from heart disease, anyone who's in their life is going to be aware if they're at high risk for a heart attack, they need to be prepared for what happens if that person has a heart attack. In the same way, someone with a substance use, particularly someone who's injecting drugs or using any kind of opioids, is at an increased risk for an overdose. And we know that, but unlike heart disease, which we haven't criminalized and haven't stigmatized, our society has treated substance use disorder as a criminal behavior and a moral failing. So as a result, a lot of times friends and family don't take the precautions that would help protect their loved one, or they distance themselves from their loved one. And as a result, people find themselves injecting substances by themselves in places where there aren't other people around. There aren't people who are checking in on them. And really with the rise in available naloxone or Narcan, the overdose reversal drug, we found that having a person, a bystander there when someone overdoses, really is a life and death question. If someone is there and there's Narcan, the likelihood that that person survives is astronomically higher than if nobody finds them until they're dead. So as part of our work trying to distribute Narcan to participants in the syringe exchange and at the Moore Center, our medication-assisted treatment program, we've also really talked to participants about not only not injecting by themselves, but also the people in their life who inject drugs, being there for them. And as a result of syringe exchange participants really taking care of their friends and family members who inject drugs, we've already seen a huge increase in bystander reversals of overdoses. Our own participants have reported over 1,200 overdoses reversed with Narcan. And we've also seen a 300% increase among EMS runs, where they're finding 4 times as many cases. Once they arrive, the person has already received Narcan from a friend or family member, which really increases their likelihood of survival and lowers the cost to EMS in terms of what they're then having to do to try to reverse the overdose or revive the person.
Although the whole purpose, one of the main purposes of the syringe exchange is HIV and Hep C prevention. But more importantly to me, it is that social connection, because the more positive interaction you have with people, the more likely they're going to come to you for help. I think social connection is the basis to everything. You can't ask people that don't have any community support or support at all, you can't ask them to pick themselves up all by themselves when they have these layers and layers and layers of things that they have to crawl through to even function. The connection that I have to participants in here is not most places that they go, they're treated very badly. And that is one thing that we focus on. I treat people that I see and hear the same way that I do people that I see walking down my street or at Kroger or wherever. And that is not how they get treated most places. They are coming here trying to be as healthy and safe and responsible as they possibly can. And that's an awesome positive step. But all of that is made through social connection. You know, if they get here and everything's sterile and they're not smiled at and people aren't talked to, I mean, we don't like to be treated that way. I don't like it when people pass me on the street and don't at least say, they don't have to say hi, they can at least acknowledge that they walked past me. I just think that is something that's missing, and that could be a way to get around a whole lot of stuff. Not just addiction, but certainly overdose. It supports everything.
So we know that social connection matters in a host of health issues. We know it's particularly important in health issues that involve stigma or that involve a stigmatized behavior. And so we're just trying our best to focus in on how to undo the damage of that stigma, undo the damage of the criminalization of those behaviors, to make sure that people can live the healthiest lives they can.